Hi everyone, myself Anup Dosheti. As I'm studying in third year MBBS in Gulbarga Institute of Medical Science, we are going to learn about the deviated nasal septum. Let us begin with the etiology of deviated nasal septum. As deviated mainly causes birth trauma or developmental error. There are percentage of DNS chances in a person is 1 to 80% as per new guidelines. As now we shall see about the types of the deviated nasal septums. First one, it includes anterior dislocation. In this, nasal septum is deviated to one side of the nasal cavity. Second is sheath-shaped deformity. As in this, we can see the simple curve on the one side like this, which causes obstruction on one side due to less space and other due to hypertrophy of turbinates. Next is S-shaped deformity. It is mainly in vertical or anteroposterior plane deviation. Fourth one is spur formation. Spur formation. In this, there is a projection formed at the cartilagino-bony junction, which leads to nasal obstruction. Now we shall talk about the clinical features of deviated nasal septum. It includes firstly nasal obstruction. Patients comes with nasal obstruction. It may be unilateral or bilateral, depend upon the duration as well as dislocation. Next, we can see patient with headache. This is due to the nerve i- is compressed by DNS on lateral wall, which leads to continuous headache. Third is recurrent sinusitis. It is due to as DNS will cause poor ventilation of ostia of sinuses. So it leads to recurrent sinusitis. Epistaxis due to dry air effect. There may be anosmia. We can see middle ear infection due to obstruction in the eustachian tube as well as external deformity also is seen. As clinical features seen are following nasal obstruction, which can be unilateral or bilateral. We can see headache that compresses. Nerve is compressed by DNS on lateral wall, which leads to continuous headache, recurrent sinusitis, epistaxis, anosmia. Anosmia is due to decreased in the inspired air to reach over the olfactory region, which leads to total or partial loss of smell, which is known as anosmia. As we can see middle ear deformity, external deformity. As next part, we see what we can see on examination. As we can see external deformities on inspection of external ear. As on anterior rhinoscopy, we can see following points. We can see deviation of septum, hypertrophy of terminates. We can see any sinusitis if present. As important next test is cold spatula test. It is not a specific test, but it can be done. As in this, we keep the tongue depressor over the filtrum and we ask patient to breathe over it and we see for the mist. Where the mist doesn't form, it seems that side there is a nasal obstruction. As well as we can confirm the DNS, sorry, it diagnosed by nasal endoscopy, confirmed by CT scan as treatment part. As in this, most of these are asymptomatic and in symptomatic some patient, we can go to type of medical and surgical. In medical, we can use nasal steroids, nasal decongestants. as well as antibiotics. This for short period. If does not work for 3 to 6 months, then we go for surgery. Usually there are two types of surgery. That is submucous resection operation. Next is septoplasty. As usually now it is preferred septoplasty. As we cover this detail about surgery in next few more classes. Thank you. Please subscribe, like and share.